Did you know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? Even more striking, many find out too late when treatment becomes more complicated. But it doesn't have to be this way for you. Prostate cancer, when detected early, has a cure rate of over 90%. Today, I'm going to share crucial information that could literally save your life. You'll learn how to identify the early signs, understand prevention methods, and, most importantly, discover why that infamous digital exam, which so many fear, could be your greatest ally. Let's break taboos and talk openly about a topic many men prefer to avoid. The prostate is much more than a simple gland in the male body. It plays a crucial role in the reproductive system, being responsible for producing the seminal fluid that protects and nourishes sperm. Imagine this gland as a silent guardian, located just below the bladder, surrounding the urethra, and its size can vary with age. When we talk about cancer, we are dealing with the uncontrolled growth of cells that may start subtly and develop without initial symptoms. It's like a sneaky invader that begins to multiply chaotically, potentially compromising the normal function of the prostate and, consequently, affecting the entire urinary and reproductive system. Doctors explain that this abnormal growth can occur in different ways. Some cells begin to divide rapidly, ignoring the natural signals to stop. These rebellious cells can form tumours that over time may spread to other parts of the body, a process called metastasis. It is crucial to understand the difference between benign and malignant conditions. Not every change in the prostate means cancer. Benign prostatic hyperplasia, for example, is a common condition in older men that causes an enlargement of the gland but is not cancerous. However, this distinction can only be made by a healthcare professional through specific tests. Tumour. Growth can obstruct the urethra, causing symptoms such as difficulty urinating, weak or interrupted urine flow, or a feeling of incomplete bladder emptying. But beware, many men may not show symptoms in the early stages, which makes preventive screenings absolutely crucial. The complexity of this gland shows us how intricate the human body is. Each cell, each function has a specific role, and when something starts to function abnormally, we need to be attentive and seek qualified medical help. Science is constantly advancing in understanding this condition. Recent research shows that genetic, environmental, and even lifestyle factors can influence the development of prostate cancer. This means we have more power than we imagined to protect our health through conscious choices and regular medical checkups. Understanding the prostate, knowing how it functions, and being alert to possible changes is not paranoia, it's care. It's about respecting your own body and its complexity, ensuring quality of life and longevity. Let's treat symptoms as important alerts from our body. Many men ignore subtle signs that may indicate significant changes in the prostate. Difficulty urinating, increased frequency, especially at night, or a weaker urine stream can be early indicators of something that needs to be investigated. Pain or discomfort while urinating should not be minimized or masked with self-medication. Blood in the urine or semen are also warning signs that require immediate medical evaluation. It is crucial to emphasize that these symptoms do not necessarily mean cancer, but they represent a call from the body for a more detailed investigation. Silence can be dangerous. Many men develop a culture of invisibility regarding their own health, especially when it comes to intimate exams. This attitude can turn a potentially manageable issue into a serious and difficult-to-treat condition. Experts recommend regular urological checkups, particularly after the age of 50. For men with a family history of prostate cancer, the age for starting preventive exams may be moved up to 45. Genetics play a significant role, and knowing your family history can make a difference in early detection. A visit to the urologist doesn't have to be a tense moment. Well-prepared professionals create a welcoming environment, explaining each procedure and addressing any concerns. The digital rectal exam, though it may seem embarrassing at first, is quick and essential for evaluating the prostate. It's important to note that not all symptoms will manifest simultaneously. Some men may show only a subtle sign, while others may have no noticeable symptoms. This variability underscores the importance of regular preventive checkups. Medical technology has advanced significantly, making diagnoses more precise and less invasive. Tests like PSA, prostate-specific antigen, can detect subtle changes long before physical symptoms become evident. Listening to your body, breaking through cultural barriers of machismo and fear, and seeking regular medical follow-up are actions that can completely transform the prognosis of any prostate condition. Health is not a luxury, it is a right, and a personal responsibility. Speaking directly about risk factors, let's understand what increases the chances of developing this condition. Age plays a major role in this story. After 60, the risk rises significantly, but that's not the only determining factor. Genetics plays a crucial role. If there have been cases of prostate cancer in your family, especially in close relatives like your father or brothers, your alert needs to be on. In these cases, doctors recommend starting preventive screenings earlier, around the age of 45. The racial factor also plays a role. African American men have a higher predisposition to developing this type of cancer. Studies indicate that in this population, not only is the risk greater, but they also tend to develop more aggressive forms of the disease. Lifestyle is another determining factor. A diet high in saturated fats, low vegetable intake, a sedentary lifestyle, and obesity can significantly increase the chances. Every daily choice counts in protecting your health. Excessive alcohol consumption and smoking are also on this list of risks. These substances cause cellular damage that can potentially lead to the emergence of cancerous mutations. Male hormones, especially testosterone levels, can influence the growth of prostate cells. Natural hormonal changes due to aging or those caused by specific medical conditions may increase this risk. Environmental exposures also need to be considered. Some studies suggest that prolonged contact with certain chemicals, such as pesticides, may raise the likelihood of developing this condition. It's important to remember, having one or more of these factors does not mean automatic development of the disease. These are indicators that demand attention, investigation, and most importantly, regular medical monitoring. The key lies in information, understanding one's own body, and prevention. Every man is responsible for his health, and understanding these risks is the first step toward a safer and more conscious life. Prostate cancer screening tests are true guardians of your health. Let's demystify two fundamental procedures that can literally save lives: the PSA and the digital rectal exam. The PSA, or prostate-specific antigen, is a blood test that measures the levels of a protein produced by the prostate. When levels are elevated, it may indicate some change in the gland. But beware, it doesn't automatically mean cancer. Infections, inflammations, or hyperplasia can also increase this marker. The famous rectal exam, the one that makes many men shudder just thinking about it, is actually a quick and essential procedure. For a few seconds, the doctor evaluates the consistency, size, and any possible changes in the prostate. Yes, it may seem uncomfortable, but it's infinitely less complicated than treating advanced stage cancer. Together, these tests form a powerful duo in early detection. The PSA provides laboratory data, while the rectal exam offers a direct physical assessment. One complements the other, significantly increasing the chances of identifying any suspicious changes. Many people spread the idea that getting a PSA test is enough. Wrong. Experts always recommend combining both methods. An isolated result can mask important information. Modern medicine works with multiple indicators to ensure accuracy. Medical technology has evolved, making these procedures increasingly safe and precise. New methods such as magnetic resonance imaging and ultrasound-guided biopsy complement traditional exams, offering more refined diagnoses. Experts advise that men over 50 years old undergo these exams annually. For those with a family history of prostate cancer, the recommendation is to start earlier, around 45 years old. The frequency may vary depending on each patient's individual profile. The results should not be a cause for panic. They are tools that allow us to act preventively. An abnormal result does not mean a definitive cancer diagnosis, but rather a sign for further investigation. Early detection drastically increases the chances of successful treatment. Statistics show that when identified in the initial stages, prostate cancer has over a 90% chance of complete cure. Courage is not the absence of fear. Courage is facing that fear, undergoing the necessary tests and taking care of one's health. Every man has the power to write his own story of prevention and self-care. Treatment options for prostate cancer are as personalized as a fingerprint. Each case is unique, and modern medicine understands this uniqueness as fundamental to therapeutic success. Imagine the treatment as a strategic map, where each decision depends on multiple factors: the patient's age, the tumor stage, health conditions, and even personal preferences. Surgery, for example, is no longer a standardized procedure, but a highly precise surgical technique, often performed with robotic assistance, allowing for less invasive interventions. Radiotherapy has evolved significantly. Today, it uses technologies capable of directing specific radiation to cancer cells, minimizing damage to healthy tissues. Techniques like intensity-modulated radiotherapy enable more precise treatments with fewer side effects. Hormone therapy emerges as a smart strategy to control tumor growth. By reducing testosterone levels, we can weaken cancer cells, preventing their proliferation. It works as a strategic blocker that interrupts the tumor's fuel. Immunotherapy and targeted therapies represent the future of treatment. These are approaches that stimulate the immune system itself to fight cancer cells or specifically attack genetic mutations responsible for tumor growth. Personalized medicine is revolutionizing treatment. Detailed genetic tests allow for the identification of specific markers, enabling increasingly individualized and effective treatments. The treatment decision should not be made alone. A multidisciplinary team composed of urologists, oncologists, radiologists, and psychologists works together to define the best strategy. The patient needs to be the protagonist, understanding each step and actively participating in the decisions. It is important to emphasize that treatment is not just about the physical fight against the tumor. Psychological support, nutritional, guidance, and family support are fundamental elements in this journey. Comprehensive care considers the physical, emotional, and social aspects of the patient. Medical technology is advancing rapidly. What today seems like a complex treatment may tomorrow be a simple and painless procedure. Hope and resilience are powerful allies in this battle against prostate cancer. Preventing prostate cancer is not just a matter of luck, but of conscious and smart choices. Our diet can be our first line of defense in this battle. Imagine turning your daily plate into a protective shield. Vegetables and fruits are not just colors on your plate. They are true warriors against the development of cancer cells. Fruits and vegetables rich in antioxidants are real superheroes. Tomatoes, for example, contain lycopene, a compound that helps fight the proliferation of tumor cells. Cruciferous vegetables like broccoli, cauliflower, and cabbage have substances that aid in detoxifying the body and can significantly reduce the risk of cancer development. The practice of regular physical activity is non-negotiable. We're not talking about becoming an Olympic athlete, but about consistent movement. 30 minutes of daily walking, a weekend bike ride, or dancing in the living room can make all the difference. Exercise helps balance hormones, reduce inflammation, and strengthen the immune system. Maintaining a healthy weight is also crucial. Abdominal fat is not just an aesthetic issue, but a significant risk factor. Scientific studies show that excess weight can increase the production of hormones that stimulate the growth of cancer cells. Reducing the consumption of animal fats and processed products is another crucial point. Excessive red meat, processed meats, and ultra-processed foods can significantly increase risks. The key lies in balance and dietary variety. Adequate hydration also plays a role in this prevention strategy. Drinking enough water helps eliminate toxins, keeps the urinary system functioning properly, and contributes to overall prostate health. Managing stress is equally important. Practices such as meditation, yoga, or simply setting aside time for leisure can positively impact your hormonal and immune health. Our body responds directly to our emotional states. Supplementation, always, under medical supervision, can be an ally. Vitamin D, zinc, and selenium are nutrients that may contribute to prostate health. But remember, nothing replaces a balanced diet and an active lifestyle. Prevention is not an impossible task. It's daily choices, small actions that add up to make all the difference. Your body thanks you for every conscious choice. Discussing prostate cancer is no simple task. Historically, this topic carries stigmas that paralyze many men, turning silence into an almost insurmountable barrier to self-care. How many men choose to ignore signs from their own bodies out of fear, shame, or a toxic masculinity that interprets vulnerability as weakness? Open dialogue emerges as a powerful tool to dismantle these walls. When a man shares his experience, whether of prevention, diagnosis, or treatment, he not only takes care of himself, but also paves the way for others to break free from isolation. Every story of overcoming is a beacon that illuminates possibilities and dispels fears. Family plays a fundamental role in this communication. A simple encouragement, a hug, a word of support can be the necessary push for a man to break the silence and seek medical care. Often it is the gaze of a wife, the embrace of a child, or the concern of a loved one that mobilizes the courage to face the unknown. Breaking taboos also means redefining masculinity. Taking care of one's health does not diminish a man's strength. On the contrary, it demonstrates maturity, responsibility, and self-love. It is necessary to deconstruct the idea that strong men do not feel fear or do not need help. Communities also play an essential role in this transformation. Support groups, informative talks, and awareness campaigns can create safe environments for men to share experiences without judgment. Collective dialogue normalizes the topic, reduces stigma, and promotes a culture of prevention. Every honest conversation about prostate cancer saves lives. These are stories that inspire, showing that a diagnosis does not mean a death sentence, but rather the possibility of treatment and overcoming. These narratives transform fear into knowledge, isolation into connection, and fragility into strength. Courage is not about never feeling fear, but about facing it. And this confrontation begins with a simple conversation, with the willingness to look within oneself, to recognize vulnerabilities, and to seek help. Taking care of your health is a revolutionary act of self-love and respect for life. The time has come to unite all the information and turn knowledge into effective action. Every detail shared about prostate cancer serves a greater purpose, saving lives. Preventive exams, symptoms, risk factors, everything converges into a central message. Take care of yourself, seek information, break the silence. Don't wait for severe symptoms to act. Prevention is not a luxury but a necessity. Your body deserves attention, respect, and care. Set your fears aside and take control of your health. The next success story could be yours.